Dear participant of European Conference on Equine Facilitated Therapy, my name is Sanna Mattila-Rautiainen. At the moment, I hold 50% of employment at the University of Eastern Finland in biomedicine. I have been sole practitioner for over 30 years, giving services to the Finnish government in a form of equine facilitated therapies from the perspective of certified physical therapist with specialization to sports medicine. Within the European Equine Facilitated Therapy Network, we started to talk about our shared interest in case studies and education. So we formulated a subgroup which was named as Reserving the Knowledge Group, or a case study group late 2019. We have held about 10 meetings between January 2020 to May 2021. Our group turned to moderate a physical therapy roundtable at the HETI 2021 Seoul Congress. So, what goals have we had for the group during these years? I have been discussing with my colleagues who are teachers within the education of equine facilitated therapy, how our students are completing their final work. We thought that we would like to review the current case study collections in countries that have been conducting the education or the final case studies like we have. We thought that the main benefits of collecting the data from different countries would be a publication and distribution of the potentially useful materials which are not yet published into full articles in a scientific journal. The main issue that we saw was that our current material is collected in a multilingual and of diverse nature of materials, meaning the format in which they have been collected, in greatness of the volume, and also in depth they have been conducted during the education. After going through this discussion, we thought that we would like to propose some guidelines for different European educations to conduct case studies focusing on the therapy domain. So, why do we think we want data collection that is similar in European level? For first of all, we thought that the discipline would be better accepted in the governmental level in Europe. Also, we thought that education would provide some educational similarities. And this could also open a window for research opportunity of the material that has not yet been covered. I conducted an online questionnaire in January 2020, asking that does your government support the treatment of equine facilitated therapies in your country? I received 11 answers from 10 different countries in Europe, and 63.6 responded that the government did not support the treatment of equine facilitated therapies, which left 1/3 of the country supported for the treatment by the government. Equal percentage of the respondents said that the government supported the education for equine facilitated therapies. This leaves me with the conclusion that the support of the treatment and education goes hand in hand. Why do we need data collection and documentation? By gathering data, we are trying to represent reality, not just our assumptions. We know what we do is effective towards our clients, but do others also believe in the work that we do? I think our clients do, and also our colleagues do. As we saw in the previous slide, we are not equal within the European level for the governmental support of the treatment. When we start to collect the notes of our practice, the evidence creates a link between theory and practice. It is possible to create field tests that serve equine facilitated therapies, or is there another way to gain more acceptance in the governmental level? And also to help researchers to represent the reality of what we are doing in numbers. So, what information have we started to gather? First, we have started to create a list of final written theses from Great Britain, Sweden, and Finland. Some of the numeric data examples we gathered in the Excel sheet were outcome measures, pre and post intervention, length and duration of the session or sessions, a number of clients or patients included, the age and diagnoses of the person receiving the treatment. Other information we have started to gather are instructions for writing of a thesis in equine facilitated therapy education. For this purpose, we have also created a web-based document. Where do we want to gather patient or client documentation? Firstly, there are some countries that require the patient documentation by law. Also, for example, Finland, we have a governmental patient repository. From the government, all patient repository, the client or the patient is able to retrieve and read the material the therapists have written of the session. Also, by gathering data day by day of our clients, we are representing the reality, what we do in our work, and we don't need to express the assumptions of the work we are doing. Within the ready applications that are at the moment there, we have no systematic or consistent way to gather the patient information in European level. In my opinion, it is important to outline the role of the horse within the session. Equine facilitated therapy is not the cheapest treatment available, which means we need to justify the importance of the horse within the therapy. Not only does the documentation do all the above mentioned, but in the long run, it does raise the standard of the individual practitioner and our whole profession. What is the role of equine facilitated therapy in rehabilitation? Equine facilitated therapy is a part of systematic rehabilitation process, addressing the needs and goals of the rehabilitee. It is a part of our welfare process, and the rehabilitation itself is a combination of simultaneous and well-timed services for each and every problem or goal that our client has. Within the therapy, the rehabilitee client is increasing abilities to function with the aid of equine facilitated therapy professional. Time and amount of treatment recommended are defined within the process of the rehabilitation. When we are assessing the goals, we need to visualize how equine facilitated therapy is effective in the process. When we think of coding or documenting our patients, we might want to start coding with international classification of functioning with ICF. What about case study? A case study has a flexible approach to the therapy. It also is an interpretation of the theory that is shaping the findings of our therapy process. In the case study, the cases are embedded in a world with real complexity. It is individual, and we can all always ask, who defines the profits for the client and whose criteria is used to determine the profits for the individual? Do we look for the whole picture of the therapy process, or do we stick to the parts of goals? And within the process, do we follow the process or the weighted results of the outcome? If we would like to create a repository of abstracts to equine facilitated therapy of the case studies, who would be owning the repository? Could that be Horses in Education and Therapy International based? Who could be able to withdraw the collected data from there? Do intervention or assessment tool work under ideal conditions or at the stable environment too? How do we reserve the knowledge? I think the best way is to reserve the knowledge so that it covers a certain area or discipline for data collection. For example, dividing disciplines to different therapies. We need to fill a big picture of equine facilitated therapies and formulate common strategy to conduct data collection. We also need to decide the implementation of knowledge management. Do we want to implement the gathered knowledge for the educators, to other practitioners, to the government, or to the researchers? Do we have an interest to formulate similar guidelines within different countries? And if we have interest, do we want to share some modules of the education in different countries? and who could be mastering the education modules. I have shared with you information on thoughts we have gathered within the Reserving the Knowledge group and added some of my own thoughts. I am happy to answer the questions you have for me. Me and my Finnhorse mare, Harvis Amanda, would like to thank you for listening to my presentation. Picture of Amanda is taken by Mattila-Rautiainen.